This is what we're going to talk. This is what you're going to learn about. For those of you who already know it, maybe it's just going to be a refresher. Acute versus chronic inflammation, medical conditions caused by it, and the best part is what you can do about it. There's tests that we can test for supplement depleting medications and anti-inflammatory foods. You heard of those too? Yep. For those who, yeah, okay, awesome. Okay, well, hopefully this will be a refresher. So this is a 6-minute presentation on hopefully something that can change your health and the health of your children and grandchildren. For the first time, the data shows that our grandchildren will actually die before their parents. Okay, what is acute inflammation? Everybody sprained their ankle or something like that, right? The body rushes in, the white blood cells come in, they do their thing, activates the immune system. This is exactly what we want to happen. This is the body's natural way of protecting us. This is called activation of the immune system and the acute inflammation. Anybody ever hear a sprained ankle like that? I have. 5 signs: it gets red, swells, there's a lot of heat, there's pain, and loss of function, right? You can't use something as well. Same thing kind of happens with chronic inflammation. We get loss of function, we get heat. We don't necessarily see the swelling. In conventional medicine, there are many terms that stand for inflammation. The itis is the suffix that means inflammation, so it's a well-known fact that we have inflammation. This is inflammation of the bronchi, inflammation of the colon, inflammation of the tendons. That's what all of these stand for. There's a nice little knee with a lot of inflammation in it, like arthritis. Chronic inflammation. Anybody here ever had a campfire or a fireplace in your home where you've watched the twigs, the branches burn down and it looks like the bottom of this screen? That's kind of what's going on the inside of your body. Inflammation destroys your arteries. So it might get a little nick in it, like the one down there in the left. It's like a smoldering fire. So it's not a good thing. 8 years ago, this magazine article came out in Time, The Secret Killer, the link between inflammation and all the major diseases. I was working at Emory University Hospital, and I thought, aha, now we know what to tell our heart patients. Anybody ever hear of this 8 years ago? A couple people? So it's been around for 8 years, and they've been doing research on it for weeks and weeks and months before that. So here's all the things that chronic inflammation can do inside your body. Damage the arteries, causing heart disease and stroke. Depress the immune system. There's like 80 autoimmune diseases now. Promotes cancerous tumors, cancer. Destroys nerve cells in the brain, Alzheimer's. Everywhere I go, all the care provider meetings, they're adding on units to their Alzheimer units. Why? All right, here's all the medical conditions linked to it. Pretty much about everything you can think of. Cardiovascular disease, Alzheimer's, diabetes, arthritis, cancer, pulmonary diseases, neurological diseases. This is one of the major causes of all of those diseases. There's a physician I really like. She's in Arizona. Her name is Dr. Martha Grout. She's got a great book out there if anybody wants to read it. It's based on functional medicine. It's called An Alphabet of Good Health. Chronic inflammation gradually destroys an otherwise beautiful machine. We already have these phenomenal bodies. They are beautiful, and things go wrong with them, as in this one here. He's got a little red areas of cancer. All right, so you got that part now? Now, do you know what to do about it? Anybody? Couple people? All right, well, this is what you get. Well, today you get to learn about it, but then you're going to do something about it, right? Going to take action? We don't want to just take the information and sit with it, right? No, we want to take action. All right, the first thing you can do is ask your physician to check these lab tests. High sensitivity CRP and the homocysteine really are the best ones, I think. It will tell you if you have inflammation. And guess what? If you do have inflammation, if your homocysteine level is elevated, you can actually take some B vitamins to lower that. We don't need something high-tech, expensive necessarily. So those two blood tests. Almost every medication we take depletes vitamins and minerals from your body that we use for other functions. This is the anti-inflammatory medications, ibuprofen, aspirin, those kinds of things. Here's 3, and there's 2 more on the next slide that are taken out every time you take an ibuprofen. And you can see all the different functions of that particular vitamin mineral. Some people take ibuprofen on a daily basis, 3 or 4 times a day. So this is what they're losing out on when they do that. Glutathione and vitamin C. These are also taken out every time you take ibuprofen or an aspirin. Anybody here heard of glutathione? They're doing a lot of research on it nowadays. It's called the master detoxifier and the maestro of the immune system. So really, really interesting research being done on that, but every time you take an aspirin or ibuprofen, you deplete your body of it. Vitamin C can't do anything or heal without it. These are just steroids. Some people take these for more serious conditions. It's usually for a shorter time they take it. However, there's 12 things taken out of the body every time they take it. They do take that every day for whatever the period of time is they need it. Once again, folate and iron are taken out from this also. These are a couple other causes of inflammation in our body. As we've all heard, stress is a major factor. It sends out a chemical in our body. Environmental toxins are probably the major cause of cancer nowadays, and there's 80,000 of them in our universe. And then inflammatory foods, and that's the part we'll really focus on. I think what's important to know is that we can do something to create our health. It doesn't, once again, have to be high-tech or expensive. So we're going to talk about anti-inflammatory foods. Eating the rainbow. I'd love to start a campaign about this. They have it some places. Eating the rainbow, all the colors. They have all kinds of isoflavones and phytonutrients and things like that that are good for us. And it's easy to figure out what foods are the colors of the rainbow, right? It's all the yummy looking ones. So here's all the foods that are inflammatory. Probably everything you've probably had to eat today. Red meat, dairy products, sugar, artificial sugars, wheat. Anything that sits on the shelf for any length of time has the trans fats, the bad oils in it. Corn products, processed foods. Don't put stupid things in a smart body. Here's the things you can eat. A little bit of a shorter list, right? So we know that fish is good for us. Leafy green vegetables, I think, are just a phenomenal food. Turmeric is actually getting a lot of research on, that's an anti-inflammatory spice. They're looking at that with cancer prevention. There's some amazing research out about that. Once again, eat the rainbow. Here's a couple of my favorite quotes. True healthcare reform starts in your kitchen, not in Washington. There's actually physicians that are teaching patients how to eat, how to cook. And life expectancy would grow by leaps and bounds if green vegetables smelled like bacon. Yep. And the last one is Hippocrates, father of medicine. Leave your drugs in the chemist spot if you can cure the patient with food. We've gotten way away from this. Our doctors aren't necessarily actually doctors of health. You know, there's not MD of health. They have a specialty of some disease. So each and every one of us can do something about our health, and it's not that hard. So thank you.